Osteogenesis Imperfecta, Type 1. Osteogenesis imperfecta, also known as brittle bone disease, affects 1 in every 20,000 live births. It's commonly referred to as brittle bone disease as someone with osteogenesis imperfecta has bones that are weaker than the average person and bones that break more easily than the average person. Osteogenesis imperfecta is equal in both female and males. Its age of onset is birth, and it continues with someone who has osteogenesis imperfecta throughout their entire life. Osteogenesis imperfecta is not more common in a specific country or area of the world, as well as not more common in a specific ethnic group. There are 3 main tests that can be used to diagnose someone who has OI. First off, the easiest is an X-ray. An X-ray, which can be taken at any hospital or even at walk-in clinics, is able to tell doctors how many fractures and broken bones a patient has, as well as how new or old the fractures are. This can help determine how many fractures they have to help determine if the person has OI. As well as DNA tests using blood or saliva, which does sequencing at the gene level, takes 6 months and approximately $2,300 to test, but it's also a test available for OI patients. Lastly, a collagen biopsy, which is also known as a skin biopsy, using a punch biopsy, which takes a small piece of skin off of your body. It is used as the same test that is used for patients that might have skin cancer. Because OI affects connective tissue, this test is very effective. A collagen biopsy examines the fibroblasts and costs approximately $800 to $1,700 and only takes 6 to 8 weeks to get your results. Osteogenesis imperfecta type 1 is autosomal dominant. If we take a look at the pedigree, we can see that everyone that is colored in black has osteogenesis imperfecta type 1. We can see how osteogenesis imperfecta type 1 is passed on from generations to generations. Osteogenesis imperfecta type 1 is caused by null mutations in the COL1A1 gene. A null mutation means that the COL1A1 gene is not working, which causes type 1 collagens to not be forming properly in someone that has osteogenesis imperfecta type 1. Analysis of the production of type 1 pro-collagens in type 1 fibroblasts cultures synthesize and organize the skin's connective tissue. This can help someone see, a doctor or a scientist see if someone has osteogenesis imperfecta type 1. The COL1A1 gene is located on chromosome 17. And is located on the long arm of chromosome 17. In type 1 osteogenesis imperfecta, the mutation reduces the production of pro-A1 chains of the COL1A1 gene. Cells are only able to make half the normal amount of the type 1 collagen because of this mutation. In more severe cases of osteogenesis imperfecta, segments of DNA are fully deleted. Someone who has osteogenesis imperfecta may have some of the following signs or symptoms. They might have a broad forehead. They may develop deafness. The white part of their eye may become blue, purple, or gray. They may have poor teeth conditions, a barrel chest or a rounded back, as well as their bones may be bent or shortened because of the amount of fractures that they've had. This is Natalie Brush, someone who is 10 years old and who has osteogenesis imperfecta type 1. Because type 1 is the most mildest form of osteogenesis imperfecta, Natalie is able to live a rather normal life. She's able to play basketball, swim, and do everything she wants to do like a normal kid. She just needs to have a few extra precautions. Kids with osteogenesis imperfecta can live normal lives, just like the average teenager or kid growing up. They can participate in sports and do normal activities. However, it's when the kid is being diagnosed with osteogenesis imperfecta that it really has a toll on the family. When you have a kid around 5 to 7 years old constantly coming into the hospital for broken bones, people have suspicions of child neglect or of abuse. This causes a lot of issues for the family because social workers get involved and the government gets involved, making sure that as a parent you're taking care of your child properly. This can be very hard for you as a parent, as you know that you're not doing anything wrong, but you want to figure out what is wrong with your kid and you don't know how to do that. when people are telling you that you're neglecting your child and that you're abusing them, when really it's something that you have no control over. So this causes a lot of stress over families that have kids with type 1 osteogenesis imperfecta, as it's something that they don't have control over, and it puts a lot of stress over them. Treatments such as IV biophosphonates are good in infants, as well as vitamin D and calcium supplements. IV biophosphonates are used to increase bone mass, and they can be started as soon as the infant is able to breathe on their own. The easiest and most well-known treatment for osteogenesis imperfecta is not really a treatment for osteogenesis imperfecta. It's the treatment for what happens because you have osteogenesis imperfecta. Needing to have a cast, wearing a cast is a treatment to help something that happened because of osteogenesis imperfecta, as well as a brace if you break your neck. Physical and occupational therapy can be used in both infants, children, and adults throughout their entire life, both on land and in water, as well as surgery. Different types of surgeries can be used, such as surgeries to insert rods into people with osteogenesis' legs to help their legs stabilize and not break as easily. To help stabilize their spines, a lot of people with osteogenesis imperfecta have scoliosis, as well as to correct bowing of the long bones. To date, there are no full cures for osteogenesis imperfecta. Doctors and scientists have been working on ways to make more severe types of OI less severe, such as making OI type 5 turn into OI type 1. However, for osteogenesis imperfecta type 1, there is no immediate cure. But to make OI disappear completely, it's a whole other type of science. In osteogenesis imperfecta type 1, normal gene therapy isn't able to work because osteogenesis type 1 is because of a dominant allele. This means that they need to try to use gene replacement. Scientists are also trying the technique of using ex vivo gene delivery to the bone. Autologous mesenchymal stem cells are genetically modified in vitro. The bone marrow will migrate to the bone when administered systemically. These techniques have currently been tested on mice that have OI, and the results are fascinating. You can see a change of 12 to 79% in the amount of the collagen type 1A gene that is being produced. To conclude, osteogenesis imperfecta affects 1 in every 20,000 live births, which means that type 1 osteogenesis imperfecta affects even less people than that. People who have osteogenesis imperfecta type 1 can live normal lives. Just need to be careful when it comes to physical contact, as their bones may break more easily. It is the COL1A1 gene that is affected in type 1 osteogenesis imperfecta. Type 1 osteogenesis imperfecta is due to a dominant autosomal trait. Currently, there are no treatments for osteogenesis imperfecta. However, like we covered before, treatments are being worked on, and things such as gene therapy are being discovered to help make the lives of people with osteogenesis imperfecta type 1 easier, and to make the condition less and less present in people. For more information, click the link in the description to find out more information about osteogenesis imperfecta.